Alright. Hello, everyone. My name is Dr. Nawal, and today we are going to cover the topic diseases of external nose, nasal septum, and its disorders. So it's going to be a very short class, but it is more towards the clinical side, the deformities of the nose and the diseases of external part of the nose. Before we start, I have to introduce you to the platform of Auricle, where we train students for university exams and for next exams. So we have already covered the topic of anatomy of nasal septum and signs and symptoms of nasal septum. Today we'll be covering rhinopharma and septal abscess, septal hematoma, because nasal cycle is mucociliary clearance, the nasal cycle of the nose that we have covered in the previous class as well. Why do you have to choose Auricle? We have 5 privileges on Auricle. We have recorded class, we have live classes, we have practical sessions, we have exam modules and hard copy book sets. Recorded classes, of course, these are all recorded classes, and you will be able to use it, come back to it, review, revise anytime you want. We have live classes. It's just like how we have it now. You will have live one-on-one session where you can ask your doubt, clear your doubts. We'll have an MCQ session, viva voce, if any doubts are asked. Express exam module is like a crash course. It's like a revision before your exam. So it will be, the entire syllabus will be covered in 20 hours before your exam. So this is only when you're thorough with your chapters and your topics, and then we have the small revision. One-to-one doubt clearing sessions is when the students approach the professors and they want to clear specific doubts. We have that too on our platform if anyone wants it. Hard copy book sets are the textbooks. So anyone who cannot have the textbook or do not have the textbook or who doesn't like reading textbook can use these hard copy book sets. We also have question bank at 3 levels of difficulties. You can download it in your Android and iOS application mobile phones, and you can customize the question bank, usually used for NEET PGs and FMGs, and can also be used for university exams. Practical sessions, we also train students for practical exams. We tell you how to present yourself in the practical exam, what can you expect from internal, what can you expect from external. So we also train students for that. We have 4 subscription plans on your screens. You can choose any. First 2 subscription plans do not have all the benefits, but the other 2 does. You can use the QR code presenting on your screens for discount on any subscription that you want to do. So let's start with the topic of nose. So what you see on your screen is the basic external anatomy of the nose. You can see that we have a nasal bone, we have an upper lateral cartilage, and we have sesamoid cartilage. These are small bones like you can see here, right? Sesamoid cartilage. We have fibroareolar tissue. That's not the bone. That's the soft tissue on your nose tip, right? That's fibroareolar tissue. Now, lower lateral cartilage is divided into 3: middle crust, lateral crust, medial crust. Okay. So you have upper lateral cartilage. Now it is called lateral, not because it's on one side. It is on both the lateral sides. So that's why it is called as upper lateral cartilage. So you have 2 upper lateral cartilages and you have 2 lower lateral cartilages. That's how they're sides. So they are called as lateral cartilages. Now lower lateral cartilage is divided into 3: middle, lateral, and medial crust. Not crust, crust. Okay, so this is basic anatomy of the external nose. Now, moving ahead, our topic is rhinophyma. But before we go to rhinophyma, you should know the disease of external nose and nasal vestibule. So I'm just going to give you a brief frame of what diseases actually happens in the external part of the nose. Rhinophyma is important at the exam point of view. It's a very important question for the exam. But I just want you to know this because it will help you for your practical exams. And if you have any MCQs, then you can solve it for FMGs. So the disease of external nose, I'm talking about external nose. So number one is cellulitis. Number two is nasal deformities, the physical nasal deformities. Now, actually, it's not deformity, it's beauty within itself. But then the sign has termed as a deformity. When you have saddle nose means your nose tip is a little bit diverted towards the upside. It's a depressed dorsal dorsum of the nose and your nasal tip a little bit elevated. This other structure called hump nose. Now, this involves the bone and the cartilage both. So your nose will be a little bit humped. I'll draw these diagrams and I'll show you. And there's something called crooked or deviated nose. Now, it's because you have a crooked nose, a witch nose, or we say as a C-shaped nose or an S-shaped nose. So normal nose is just what you see on the screen. All right. Saddle nose will be that the tip of the nose is somewhere like this, right? So this is the tip of the nose. Now this is, it's termed as deformity in our books, but then people are preferring this for cosmetic appearance nowadays. So you have a tipped nose, right? And the other is supra-tip depression. That's when you have a depressed tip. So these people will have, this will be the nose. The tip of the nose will be depressed. All right, it will not be pointed. And the other one is humped nose. Now, humped nose is again beauty within itself, but then people are not preferring it nowadays. It will be pointed and they'll have a hump here on the tip. Okay, so these are basic, nasal deformities that everyone should know: saddle nose, hump nose, crook or deviated nose. Now, coming to other point, crooked nose that I told you, crooked nose is deviated nasal septum. It can be a little bit deviated or it can come deviate and come back to normal place. So it can be either like this, not so much, but it can be just deviated on that side. The angle will be deviated to the opposite side. So these are not diseases, but nasal deformities. Now, on the disease topic, we'll have tumors. Okay, now, every tumor is divided into malignant and benign. Now, here we are going to divide the tumor into congenital, all right, and benign tumors. Then we have malignant tumors. So it's not just benign and malignant. It is congenital, it is benign, and it is malignant. So tumor of nose. We have three categories: congenital, benign, and then malignant. Okay. So congenital, we have dermoid cyst, we have encephalocele, and we have glioma. So these are congenital tumors of the nose. Write it in a different color. Congenital. Number one, glioma. Number two, dermoid cyst. Also known as simple cyst. Dermoid cyst is also known as simple cyst or simple dermoid. And then we have encephalocele. So dermoid cyst is of two types: simple dermoid and dermoid with sinus. Okay, what happens in simple dermoid is the midline swelling under the skin. Okay, all these are skin, related to skin. So there is a midline swelling under the skin and in front of the nasal bones. Now, these tumors will not open externally. Dermoid cysts on the dermoid cyst in the sinuses are seen in infants and children. Okay, so they will have a pit or sinus in the midline of the dorsum. But in adults, that is a simple dermoid, they will not have pits. Okay, I'm just going to give a brief about each one of them. You do not have to just dive into a lot of detail. Now, coming to the point of glioma. Glioma, it is a nip of portion of encephalocele. So what is encephalocele? Encephalocele, it is a herniation of brain tissue with its meninges into the bony defect. So encephalocele is actually the herniation of the brain into the bony defects of the bone. Now, an extranasal meningocephalocele presents with subcutaneous pulsatile swelling. All right. Swelling will show cough impulse. So you will, when they will cough, that defect will just pulsate. Okay. So of course you'll have to treat this neurosurgically. But just remember that encephalocele is herniation of the brain through the bony defect, nasal bony defect. Now, glioma is when that portion is nipped off. Okay, that will lead to glioma. Now, let's move to the topic of rhinopharma. Rhinopharma is actually a benign tumor. Okay, now they arise from the nasal skin. So if you can see here, it is actually the defect of the skin. What happens here is that the rhinophyoma, uh, there will be hypertrophy of the sebaceous glands on the tip of the nose. Now, your nose tip has a lot of sebaceous glands. That's why you have black heads, white heads. You sweat. Some people will sweat on the nose, right? That is because your nose has a lot of sweat glands. Now, when these sweat glands undergo hypertrophy, what is hypertrophy? Increase in the size, right? So when the sebaceous glands will increase in the size, that is hypertrophy, what will happen is that it will start showing this tumor that is known as rhinophyoma, also known as potato tumor. So it is usually seen on the tip of the nose because your tip of the nose will have sebaceous glands. So what is the definition of rhinophyoma? It is hypertrophy of the sebaceous gland on the tip of the nose. Okay. Okay, here it is. It is a benign tumor, also known as a potato tumor. All right. Slow growing tumor caused due to hypertrophy of sebaceous glands. This is the definition of rhinophyoma. Now, rhinophyoma is actually a pink lobulated mass. So if you can see here, it is pink. So it will be a pink lobulated mass over the nose. And sometimes what you see is you will see superficial vascular dilation. So if you can see here very carefully, you'll see this blue marks here. This is vascular dilation that the patient is having. See it very carefully. If you can see red marks here, these are all vascular dilations that you can see. Right? So these are vascular. It's a pink lobulated mass on the tip of the nose with vascular dilation. Now, this is most commonly seen in middle age, like 30s, 40s, like that. And patients will usually come to the clinic, not because it will create any discomfort to them, except that, you know, they'll have an unsightly appearance of the tumor. They'll just come for cosmetic appearance, like it's just making them insecure about their appearance. So they just come with that. But if rhinophyoma becomes enlarged like this patient, what she is having, what happens is that it will lead to obstruction of breathing. And it can also interfere with the sight because it will grow big in size. Now, treatment is paring down the bulk of tumor either with a pair of scalpel or you use something called carbon dioxide laser. So you just use laser to shrink that hypertrophied sebaceous glands. And those hypertrophied sebaceous glands will undergo reepithelialization. Sometimes what happens is that it is so worse that you will have to completely excise the tumor. And then after removing the tumor, the patient is left with no nose. So what you do is you use a nose graft, skin graft. Now we have a lot of fake noses to put on the tip of the nose, but then this is the condition of rhinophyoma. It's a very small 4-mark question that will usually be asked, very commonly asked. You should know that what is rhinophyoma? It is a hypertrophy of sebaceous glands on the tip of the nose. do not have such complications. The most common complication is cosmetic appearance, followed by if it grows bigger in size, it might interfere with breathing of the patient and eyesight. Now, if you can see here, they have chopped off the tumor and they have applied a graft here on the patient's nose, right? So it looks like she doesn't have, she never had a tumor before. Now, coming to the next topic that we have is septal abscess. So septal abscess is what? Now, this is not the disease of the external part of the nose. It is the disease of nasal septum. Now, we have finished the anatomy of nasal septum. I advise all of you to go back to the topic and understand what is nasal septum so that you have a good hold on the topics of abscesses and hematomas. So the septal abscess is usually because of septal hematoma. Okay, it is secondary infection of septal hematoma. So how does actually septal hematoma happen, or what is septal hematoma? Septal hematoma is collection of blood under the pericardium or periosteum of the nasal bone. So your nose, if you take it like this, it is like a triangle. If you look at from inferior point, it is triangle in shape, right? Now, if the blood starts collecting on both the sides, it is hematoma. Now, this hematoma can develop into an infection. So we also have a topic of septal hematoma, but before that, I wanted to understand what is septal abscess, because that's what we have on the screen first. The septal abscess is secondary infection of septal hematoma. Okay, if septal abscess is not treated, it will fall into a condition of furnicle, that is boils of the nose or the upper lip. Okay. Now, what happens here is that these patients will have severe bilateral nasal obstruction. Of course, there is an abscess in the nose, right? So there will be nasal obstruction. So they'll have bilateral nasal obstruction. Then these patients will complain of fever and chills. It's abscess. Every abscess is related to fever. Every patient with abscess will have fever, either low-grade fever or a high-grade fever. Okay, so these patients will complain of fever. They'll complain of pain and tenderness over the bridge of the nose. It is abscess. They'll complain of headache. They'll complain of redness and erythema over skin because of abscess. They'll have submandibular lymph node enlargement. It's because related to it, right? So these patients will have submandibular lymph node enlargement and they'll have congested submucosa of the nose because it's obstructing the breathing part. It's obstructing the pathway of breathing. So you can see here, this is not actually any polyp. This is an abscess. Okay. This abscess inside the septal cavity. Now, what is abscess? Abscess is secondary infection of septal hematoma. So the question arises that if there is blood in the nose and that is blocking it and it is turning into abscess, then why does it look like flesh? Right? So the answer to this is that this actually happens in the under the layer of pericardium or periosteum of nasal septum. Okay, doesn't happen inside your nostrils. So there is one layer inside your nasal septum, that is pericardium, or sometimes the periosteum of the nasal septum. So either in any two of these layers, when the blood starts to collect and it doesn't, it's either you don't reach the hospital or the ENT surgeon and you don't get it incised and you don't get it treated, it will become abscess. So this is actually when you incise this flesh-like mass, you will see abscess in this because this is pericardium or periosteal layer. That's why it looks like flesh. All right. So here how you will see this is the triangle, let's imagine. Right? And this is the abscess. This is how you will find it out. The complications if are left untreated for nasal septal is necrosis of the septal cartilage. So these patients over the time, what will happen is that the abscess will stay there and it will start to erode the bone. And it will lead to necrosis of the septal flaps. Further, that it will lead to perforation. Necrosis can perforate into septal perforation. And if there is septal perforation, so you have a dangerous area of the nose, the dangerous area of the face. So if this is your face, this is nose, lips, this is dangerous area of the face. Remember this for your future final year exams and everything. Dangerous area of the face. So in any of these structures, if there is an abscess formation in any of these structures and they stay there without getting treatment, what happens is that it will travel through the cavernous sinus and can also cause cavernous sinus thrombosis or meningitis. That's why it is called as dangerous area of the face, because it is connected to your cavernous sinus. Okay. Dangerous area of the face is connected to your cavernous sinus. So any infection in any of these parts, that's your lower nose, your upper lip, or the sides, that will lead to cavernous sinus thrombosis or meningitis. Now, this is very rare in these days because we have very uh, a lot of antibiotics and the patients are much aware. Even if they have cold, they approach to the ENT hospital. So this is very rare, but yes, this is the complication of septal abscess. So remember, septal abscess itself is a complication of septal hematoma, and septal abscess's complication is necrosis of septal cartilage. What will happen is that if necrosis doesn't heal or it is not treated properly, what will happen is that it may lead to septal perforation. And the septal abscess is travel through the dangerous area of the face. It can cause infection or cavernous sinus thrombosis and meningitis. How do you treat these patients? The only way you treat is, of course, you have to drain the abscess. So you do an incision and drainage, and you drain the abscess ASAP, as soon as possible. And the incision is made in the most dependent part of the abscess. So you have to feel the abscess, where is the pus more likely felt. And then you will have to incise it, and a piece of septal mucosa that is there, you have to extract that piece out. You cannot leave the sac inside. If you leave the sac inside, it's going to reoccur, right? So you just have to excise the whole piece of septal mucosa. And then what will happen is that you have to examine examine that area, see if the cartilage is normal. If there is some infection in the cartilage, you will have to remove the cartilage by suction. Pieces, if there is pieces or necrosis. So incision might need to be reopened daily after 2 to 3 days. So remember, any abscess, sebaceous cyst, or any abscess that you drain in your practical or clinical life, never suture them. Any abscess that you drain should not be sutured and should be kept open at least for 2 to 5 days. You keep it open, you keep on changing the dressings, you have to keep it clean, you have to drain the abscess, you have to put them on antibiotics, and slowly when that shrinks, then only you can suture them. Never suture an abscess, be it any abscess, abscess in the ear, abscess in your nose, sebaceous cyst, abscess in any sort of muscle. Never suture any abscess. And remember that any abscess should be drained ASAP. So these patients, you have to keep the abscess drained, the incision open for 2 to 5 days, and you have to keep on cleaning the wound and drain the pus if any, and remove the necrosed pieces. And then after that, you put the patient on antibiotics, of course, during this procedure. And after that, usually this will heal. This doesn't need to have an incision. But the other structures, then you will have to incise them, right? So you have to put these patients on antibiotics for 10 days. So this is the treatment of septal abscess. Now remember that septal abscess can also lead to perforation of the nasal septum. That's another story. Coming to the point of septal hematoma. Septal hematoma, as I told you, it is collection of blood under the pericardium or the periosteum of the nasal septum. Right? So it is the blood collection between the nasal septum and the overlying mucopericardium structure. It is the same word, mucopericardium, pericardium, or periosteum of the nasal septal bone. Now, this is usually due to trauma, usually seen in patients who are under the match of boxing and some sort of injury or surgery or trauma. Any sort of trauma can lead to nosebleed. All right. So causes, trauma, nasal surgery, or any spontaneous cause unknown. Pathophysiologically, Trauma causes these blood vessels in the submucosal layer of the nasal septum to rupture. Okay. Now, when these blood vessels rupture, the blood starts to collect between the septal cartilage or the bone, okay, or into its mucosal lining, not in your nostrils. It is in the layer of septal cartilage or the bone. Right? Now, if this septal cartilage or septal hematoma is left untreated, what will happen is that your septal cartilage may lose its blood supply, leading to further complications like necrosis and septal perforation, followed by nasal deformity because there will be abscess formation. That is the class complication. Now, these patients will come with symptoms. Now, the symptoms are divided into two forms: local symptoms and associated symptoms. The local symptoms will be obstruction. They'll have stuffed nose. They'll tell, my nose is always full. I cannot breathe. They'll have breathing problems. There will be swelling inside the nostrils. Usually when you palpate it, you will see it's a soft swelling. You'll see it's fluctuating. The patient will also complain of pain and tenderness in the nasal area, right? So that's all the complications. So if you can see here, this is a very good diagram where it is showing septal hematoma between the layer of nasal septum and pericardium. These are two different things. Remember, the nose is not bleeding. The blood is collected between the layers of nasal septum and the pericardium. So if in the exam, if they ask you what is nasal septal hematoma, please do not write there is blood in the nose. There is blood in the nose, but in which structure? It is between the nasal septum and the pericardium. What is septal hematoma? It is the secondary complication. It is an infection caused due to septal hematoma left untreated. Where does it occur? It again occurs in the area between the nasal septum and the pericardium. So that's why it looks like a flesh, because there is hematoma formation in this area. Okay. Now, associated symptoms will be epistaxis. This is when the hematoma ruptures, when there is perforation or leak, then these patients will have epistaxis. They'll have, of course, breathing difficulty because there is an obstruction. They'll have discomfort. They'll have, if the infection is left untreated for a longer period of time, it will lead to complication of septal hematoma. That can be followed by necrosis. So septal hematoma will lead to necrosis. Necrosis will lead to perforation, right? Septal perforations. Necrosis will lead to septal perforations. On the other hand, this is in the dangerous area of the face, right? So if there is formation of septal abscess, what will happen? They can have either facial cellulitis or they will have cavernous sinus thrombosis. Okay, so it's all connected to each other. So here you can see septal hematoma. This is the nasal septum. Septal hematoma is formed between the layer of nasal septum and the pericardium. This is how you should incise. You should find the most dependent area and you should incise it. Now, do not suture the wound. What you do instead is you pack it. Now, this is what it is. This is that they're removing the part of that septum. Just removing that part. If you don't remove the sac, the abscess is going to reoccur. It's not just for this abscess. Any abscess that you drain or that you incise, make sure to remove the capsule, remove the covering of the abscess. Every abscess will have an outer layer. Okay, so you have to remove that outer layer. If you don't remove it, it will reoccur again. So you will have to remove it and then you will have to pack the nose because now you're keeping it open and you have to pack it so that it doesn't fibrose. So you pack it and then you remove it and you dress it for 2 to 3 days and then you pack it again and then you remove it. This goes on for 2 to 3 days or 2 to 5 days, depending upon the wound healing and the wound structure. On the other side, you should keep the patients on antibiotics for 10 days. And then you should look at how it heals. Okay. So this is what we had for today. We had 3 topics: septal hematoma, septal abscess, and rhinopharma. Remember the classification of the tumors that we have. benign tumor, malignant tumor, congenital tumor. Just read through it so that you have an idea. It's a very interesting and an easy topic. Everyone should go through it once. You'll have a very good experience. It's very interesting. And I hope you like my class. Keep following us for more. Thank you.